Welcome. So this is chapter 5, part 2. We're going to mainly focus today on diabetes. So diabetes, just some fun facts real quick before we dive in. About in the United States, about 40 million people are thought to have or do have a diagnosed or undiagnosed diabetes. Okay, there are 12% of the US population with diagnosed diabetes. About 28% of the population has what we call undiagnosed diabetes, meaning they have it or have pre-diabetes, but they don't know it yet, meaning they're undiagnosed. So when we go throughout this part 2 here, um, we're going to focus on diabetes and notice how it's in the carbohydrate chapter. Okay. Because carbohydrate is the number one nutrient that a person can consume that raises their blood glucose. So let's talk about why that is. Now that we know where diabetes is found in foods, how the body digests carbohydrates, and how we need that hormone insulin in order to be able to get that blood out of our bloodstream, or excuse me, get that glucose out of our bloodstream. Let's talk about the disease, okay, and how we can possibly prevent it and help manage it. So, what is it? Diabetes mellitus has been around since ancient Egyptian times, actually. The ancient Egyptians were the first one to document the urine smelling sweet, or the urine smelling sweet, the breath of a person smelling sweet. So it is a serious, chronic disease. Okay. I am a diabetes educator by trade. I have seen the devastating effects of diabetes, but I have also seen the wonderful treatment that can be had by treating diabetes. Okay, it is not a death sentence. It is not a um, um, it can be managed very well, okay? But it does take work and it does take dietary changes, okay? So, diabetes mellitus, a group of serious chronic diseases characterized by excessive high blood glucose. So, why is high blood glucose so damaging? Okay, why does it matter that we have excessive glucose in the blood? Well, it matters because glucose in the blood at high levels damages blood vessels. Okay. And you have blood vessels in every part of your body, from your eyes to your kidneys to your toenails, all the way down to the bed of your toenails. Blood is in every organ and in every vessel in your body. So that is why it can be so harmful, especially to your eyes, your kidneys, and your peripheral circulation. So let's quantify high blood levels. So hyperglycemia, hyper meaning excessive, glyco meaning sugar, emia meaning blood. Okay, abnormally high blood glucose levels. There are two types of diabetes. You have type 1, okay, which is what we call type 1 diabetes, usually occurs or usually diagnosed early in childhood or definitely by, I'd say, the teenage years. A type 1 diabetic will be diagnosed. And a type 1 diabetic is where the pancreas does not produce any insulin or enough insulin to meet the needs. Okay, well, excuse me, type 1 diabetes is where the beta cells do not produce any insulin. Type 2 diabetes is what we often call adult onset diabetes. And that is where the pancreas either does not produce enough insulin to meet a person's needs, or the body becomes resistant to it. Okay. The body just doesn't accept what, or accept the insulin that the pancreas is producing. There's also a third type known as gestational diabetes that occurs during pregnancy in women due to the metabolic stresses of the pregnancy. It's where the body cannot keep up, okay, and it becomes a little more insulin resistant, and it's just not able to keep up during pregnancy. And they are also um, your textbook doesn't really mention this, but there is also in the research, there's a growing call to um, quantify or excuse me, describe Alzheimer's disease as what there is as type 3 diabetes, suggesting this link between insulin dysregulation and the brain and dementia. Remember earlier in part 1, we talked about how the brain loves to run on ketones and how, yes, it uses glucose as well. It's not officially recognized as a type of diabetes, so don't get me wrong there, okay? But there is a lot of research connecting Alzheimer's disease and the body's ability to not respond to insulin anymore, okay? So I would think that within the next few years, they will there's a lot more research on that. Okay, that's one of the areas that I'm studying the most, uh, um, because of that family connection that I have between Alzheimer's and diabetes. How do we classify diabetes? What are the hard numbers? Well, there is the golden test known as, or the golden standard known as the fasting blood glucose. Okay, when a person has not eaten for 12 to 24 hours, that is known, or about 24 hours is what they really like to do. That is known as the fasting blood glucose level. And a person without diabetes, their blood sugar should never get above 100. Okay. You could eat a chocolate cake the size of a desktop. Okay. Don't do it, but you could eat a chocolate cake the size of a desktop and your blood glucose never raise above 100 because your body's able to keep up. Okay. Not recommending you do that, but you understand. Pre-diabetes is where the fasting level is high, but not high enough to diagnose diabetes. So this is the warning sign, meaning you have impaired glucose tolerance, where your fasting level is between 100 and 125 milligrams per deciliter. And then diagnosable diabetes is where your fasting level is above 126 or higher. We also have what's known as a hemoglobin A1C level, which I believe we talk about later on, and we'll talk about that when we get to that particular slide. If I remember right. I think we do. I forget, but there's the fasting blood glucose level, and then there's the hemoglobin A1C, which measures the average blood glucose over the past 3 months. This fasting blood glucose is looking at a one-time snapshot. Same thing when you take your instant blood glucose with a glucometer, it's taking that instant snapshot right then and there, not an average over the past 3 months, which the hemoglobin A1C would. So what are the signs and symptoms of diabetes? Well, high blood glucose, excessive thirst. This is, and these two go together, excessive thirst and frequent urination. When your blood glucose is high, extremely high, Your body needs to get rid of that glucose. It can only store so much in the liver. It can only store so much in the muscle. It needs to, and it tries to get rid of excessive glucose in the blood through your urine. And in order to do that, it takes two water molecules to every one glucose molecule to excrete it. And even then, you can only excrete so much. So that's why a person is urinating frequently and why they are hungry, or excuse me, thirsty, is because this is the kidney's way of trying to reduce blood glucose through literally peeing it out, urinating it out. Okay. Then you have blurry vision. You have very small blood vessels in the eyes. And remember, excessive glucose damages those blood vessels. So those tiny blood vessels in the eye become inflamed, and that can lead to blurry vision. Vaginal yeast infections in females. Remember, I talked earlier about the peripheral circulation, so it can lead to foot pain, abdominal pain due to the blood vessels in the GI tract slowing down that gut motility, impotence in males. Remember, it all relates to blood vessels and blood flow, sores that do not heal, increased appetite because the body is not able to get the energy to the cells. The glucose is in the bloodstream, not being used in the cells. That fruit-like smelling breath we talked about earlier due to the high blood glucose, being fatigued easily, having that confusion. There again, all boils down to the damage being caused by the blood vessels. Notice we go from damaging to the brain to the feet and everywhere in between. Okay, signs and symptoms of diabetes. Over time, this excessive hyperglycemia, high blood sugar, damages nerves, damages organs through the process of damaging the blood vessels. Poorly controlled diabetes over time leads to heart disease, kidney failure, blindness, and possible lower limb amputations. It is a devastating disease, and it does not have to be. Diabetes, type 2 diabetes especially, can be prevented and can be controlled. Type 2. The estimated number of, like I said earlier at the beginning of the video, you see how even over the past 10 years, okay, estimated number of Americans with diabetes. And that's not even looking at worldwide. So if we look a little closer at the different types, okay, type 1 diabetes is an autoimmune disorder. It is not it is not caused by excessive carbohydrate intake. It is not caused by anything the person does. This is an autoimmune disease. We're not sure why these immune system cells malfunction. There does seem to be a genetic susceptibility to it, okay? But overall, there's no cure, and there is, but it can be treated, okay? The treatment for type 1 diabetes, remember, type 1 is where the pancreas is not making any insulin. So it's going to require regular administration of that hormone insulin and tight monitoring. Okay. This is also where you can run into the ketoacidosis that we also mentioned in the first part of chapter 5. So ketoacidosis, okay, acidosis, the abnormal condition of high blood pH due to excessive ketones. This can be a life-threatening condition, and this is a sign of uncontrolled or poorly controlled type 1 diabetes. Type 2 diabetes is the more common form, known as adult onset, and its risk factors are a sedentary lifestyle, excessive body fat, certain um, a somewhat a genetic relation. Okay, if you have a primary family member like a brother or a mom or dad with diabetes, you're more susceptible. Doesn't mean you're going to get it, but you're more susceptible. And also certain races, okay, and certain cultures, Hispanics, Native Americans, Pacific Islander ancestries, those kind of things. And so type 2 diabetes is where your pancreatic beta cells either do not produce enough insulin or your body becomes resistant to the insulin that you are producing. Gestational diabetes, like I said before, occurs during pregnancy, usually goes away after the birth of the baby, but the mother then does have a greater risk of developing type 2 diabetes later in life. The risk factors of gestational diabetes is that family history of type 2 and also being overweight or obese and sedentary during pregnancy. Females who are pregnant or have poorly controlled diabetes or gestational diabetes are more likely to miscarry, give birth to newborns who are 9 pounds or greater, and pass on that genetic predisposition to diabetes to their child. So, how do we control it? Diabetes can be managed. Okay. You can avoid or delay the serious health complications related to diabetes. Number one, and this is what I would always tell my patients is don't be afraid of your numbers. Okay. Daily monitoring of your blood glucose. You can't fix what you don't know, and sticking your head in the sand and not monitoring is not gonna help. Okay. So monitor your blood glucose for one, know your numbers so you know where to begin. Periodic measurement of what we call this glycosylated hemoglobin or your hemoglobin A1C is paramount. This is what your doctor will order about every 3 to 6 months, depending on how well managed you are. The goal is to be below 5.6. Okay, that's going to be normal. And if you are already diagnosed with diabetes, getting it down to as close to 6 as possible. And what this is measuring, when it says glycosylated hemoglobin, so your hemoglobin is your blood protein that carries oxygen on your red blood cells. So your red blood cells have a half-life of about 3 months. Okay. So glucose, when it's in the bloodstream, sticks to your red blood cells, sticks to this hemoglobin. And we're able to measure the quantity of glucose. Okay, that glycosylated hemoglobin on your erythrocytes, and that's what we're doing here. So it's an average over 3 months. So it's a test that I loved. That when my patients would come in with an updated A1C, because it's a test that you can't fudge. You know, you can't. I shouldn't say fudge. It's a test that is an average. Okay, it gives us a broader picture of glucose control other than just an isolated glucose monitor test here. So this is a glucometer. It tests capillary blood and gives you an instant measure. Okay. And this is a young man, and that is what's known as an insulin pen. So we control diabetes through glucose management. Following a special diet that involves low carb okay, and or counting your carbs. So this is where I would come into play as the clinical dietitian and diabetes educator. Number one, to explain to my patients what is a carbohydrate, where it's found in foods, and encourage them and show them methods and give them strategies and how to decrease the amount of carbohydrates they are eating. Definitely physical activity. Okay, we talked about how glucose is stored in the muscle and how excess glucose can be burned first if it's used up first through physical activity. And so that's what the physical activity is for. Losing body fat for sure. And sometimes medications are needed. Okay, so there are oral medications. There's a whole bunch. We're not going to go into the rabbit hole of the different types. And there are multiple medications that work on multiple aspects of diabetes. So you have some that cause the pancreas to increase insulin production. You have other medications that decrease the absorption of carbohydrate. You have some that work on the kidneys. So there's different kinds. And then, if needed, administer insulin, which is always needed for type 1 diabetics and sometimes for type 2s. When we look at nutrition and health equity, people, and this is where my role as a dietitian, what I really loved about my job as a dietitian was to just educate, okay? Help my patients be able to find and understand and use that information for their own health, make their own opinions, make their own appropriate health choices, and help them be in control of controlling their chronic disease. Can diabetes be prevented? Type 1, no. Okay. Type 1, no. Can be controlled? Yes. Type 2, yes, it can be prevented and or postponed, okay, and it can be managed. Your risk for developing type 2 diabetes can be greatly reduced, okay, by losing excess body fat, daily exercise, and follow a healthy dietary pattern with as few carbohydrates as possible, okay? So you see here the standard American diet of carbohydrate, 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 carbohydrate. Okay, and if that's a soda, also carbohydrate. Okay, you have carbohydrate in the potato chips, the bun, the fries, the ketchup, the soda. Okay, here you also have carbohydrate in the milk, the pasta, and the fruit. So if this was my patient, I would say and you had diabetes, I would say double the broccoli, keep the fruit, definitely keep the salmon, trade the milk for a non-caloric club soda or water or hot tea, unsweetened hot tea, maybe with a little bit of Splenda, whatever you're comfortable with. Okay. But following a healthy diet pattern full of protein, full of healthy fats, and when you do eat carbs, make sure they are in the whole form, such as whole broccoli and a whole fruit. Okay, not a processed pasta, in my opinion. Hypoglycemia is the opposite of hyperglycemia. Hypo meaning low. So this is where you have abnormally low blood glucose. And if you are on insulin, you definitely need to be monitoring this and be aware of low blood glucose. The signs and symptoms are being irritable, restless, shaking, sweaty, hungry, and it can come on pretty sudden. So, people with diabetes usually don't always feel it come on either. It can come on pretty sudden. And if you are on insulin or any type of medication that increases your insulin production, you're at risk for hypoglycemia. Okay. So to treat this, you need to ingest or take in sugar. So they have glucose tabs, they have any type of simple sugar, such as 1 tablespoon of honey, or maybe 2 to 3 of those glucose tabs, or a couple of sips of not diet soda, of regular soda, okay, with sugar in it. The trick is not to ingest. You want to ingest enough glucose to maintain and start to slowly rise your glucose. You don't want to take in enough glucose to cause you to be hyperglycemic and kind of rebound the opposite way. I've seen that happen with patients before. The next type of disease that is related to or can be related to carbohydrate intake is what we call metabolic syndrome. This is the condition characterized by 3 or more of these conditions. They're again on the rise. I see more and more patients with this every day. High fasting glucose. Okay, so a patient who is going to be pre-diabetic, a patient who has high blood pressure or hypertension, patients with a large waist circumference, and you see here male and female, patients with chronically elevated fasting triglycerides, and patients with low high density lipoproteins or your HDLs. Now we have not talked about triglycerides or cholesterol yet. We'll do that when we get to our lipids chapter, but it's coming. But a patient with or a person with 3 or more of these conditions are suffering from what we call metabolic syndrome. And it does increase your risk for type 2 diabetes and especially cardiovascular disease. So we need to treat it. Okay, we need to treat it by losing weight, exercising, and following that healthy eating pattern. Okay, and you see here, there again, we're looking at whole foods. Okay, whole fruits, whole vegetables, fiber-rich foods, whole grains. Okay, nowhere on here do you see soda. Nowhere on here do you see M&Ms. Nowhere on here do you see cakes, cookies, and ice creams. Okay, um, and these 3 words right here, losing excessive weight, is easier said than done. Okay, trust me, I know, and my patients know it is hard, but it's not worth doing if it's what does the old saying go? Uh, it's hard, it's worth it, I guess. Carbohydrate intolerance. So we talked a little bit about lactose intolerance, that ability to digest lactose, that milk sugar. And you have since you are not able to break down that chemical bond in that milk sugar, it can lead to intestinal cramps and bloating and diarrhea. We do have enzyme tablets that you can take, and there are what we call lactate, or there is lactate milk that has lactose removed. And there's also soy milks if you go down that route. Does sugar cause hyperactivity? The answer is no, at least as far as the research that we have now. Okay. Hyperactivity, attention deficit disorder. There's been several good scientific studies out there that show no, it does not indicate. In other words, eating sugar and sugary foods does not lead to these behavioral effects. Could lead to a burst of energy, okay, as we know that glucose is used for energy, but the difficulty paying attention, the impulsivity, the hyperactivity, research says no. And when we look at fiber and health, we've talked about what fiber is and the different types, soluble and insoluble. So we're not going to go down that route. But right now, I want to talk about how it can benefit diabetes and also diverticulitis and hemorrhoids, or diverticulia and hemorrhoids. So high fiber diets can reduce your risk for obesity because high fiber does make you feel fuller longer. It can reduce blood glucose at that particular meal. Well, I don't want to say reduce. It delays the absorption, okay, of glucose because it's harder for your body to absorb that fiber, excuse me. And as we said before, soluble fibers can decrease heart disease and stroke risk because of its solubility of some of those blood fats. Okay. We also, in part one, talked about how diets rich in fiber, specifically soluble fiber, reduce that cholesterol risk somewhat. And high fiber diets can be associated with the decreased risk for colorectal cancer. And we've talked about high fiber foods and weight loss. I want to end this part two by looking at this particular disorder known as diverticulia. And when you look at the small intestine, you can have these little pouches that extrude out from the lumen of the small intestine. And diverticulia here um, can become infected and can become sore and painful if filled with seeds and nuts and uh, thyme, okay, food waste. Fiber helps with this, okay? Fiber helps with this. Currently, there's no restrictions on high fiber foods. If you have diverticular disease, high fiber diets can be beneficial. Moderate, depending on if there's pain, moderate fiber can be beneficial because remember, we talked about that bulking effect, that bulking of the fecal matter and the propulsion of the food through the small intestine here. Um, so it can be beneficial. And then as far as hemorrhoids may occur if someone sits for too long or has constipation or has to strain during bowel movements due to constipation. So there again, higher fiber, hydration, exercise, hot liquids all help to keep the gut moving, keep the colon moving, and fiber, which is a carbohydrate, whole insoluble fiber, can help with that by bulking up your stools. So, how much fiber is needed? Adequate fiber intakes are between 38 and 25 grams a day. Um, And the average American, yeah, probably gets less than this. I've seen some research that shows only about 10 to 12 grams a day. So focusing there again on whole foods. Okay. Eat the whole apple instead of the applesauce. Eat the whole salad instead of the green smoothie. Okay. Eat the whole food. Get your fiber. Whole grain breads, whole grain rices. I really try to stay away from pasta. I try to, I tell my patients, try to eat, even if it's whole wheat pasta. I mean, holy cow, rice and pasta, 100% carbohydrate. It in my professional practice with my diabetic patients, even a whole wheat pasta, the fiber benefit is good. Okay. But I'm not so worried about your fiber content if your blood sugar is 300. Okay. So that's why reducing rice and pasta. Your nuts, your beans, your seeds, they're again whole foods. Eat whole food whenever possible. Okay. And then lastly, the glycemic index here is just a method for classifying carbohydrate rich foods. You're just quantifying them and comparing them to um, the standard, okay, glucose or white bread. And I did not really teach glycemic load and glycemic index a lot in clinical practice. I mean, it's good. And I'm not poo-pooing it by any means. And yes, you need to know what it is. It is a good way to quantify foods. Okay. But I found it difficult for my patients to understand. I was more focused on making sure they understood the food label and where to find carbohydrates in foods. Okay, so let me know if you have any questions or concerns and read your food labels.